Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota.
With us today is Dr. Elitza Theel, the Director of the Infectious Diseases Serology Laboratory at Mayo Clinic, and my partner in directing the vector-borne diseases testing service. Together, we direct the laboratories that perform testing for diseases transmitted by ticks, mosquitoes, and a whole host of other vectors. Dr. Theel is a frequent guest on this podcast, and I figured this is the perfect time to have her back to talk about tick and mosquito-borne diseases, given that we are now midsummer and the bugs are definitely out. So, Dr. Theel, thank you so much for being back with us today.
Thank you for having me, Dr. Pritt. Happy to be here.
So, Dr. Theel, given that July is a peak month for transmission of tick-borne diseases, would you mind starting us off with your observations of the tick season so far?
Yeah, it's another busy one for sure. Our volumes have really increased for all tick-borne testing, not just the common ones, but some of the less frequent flyers, if you will. And our positivity rates are also higher. So if you kind of do the math, we are having more positives as well. And we're seeing this positivity increase. I actually just did look through the data. We're seeing it across many different states. So higher volumes, higher positivity rates. So be careful out there.
Yeah, I agree. We're seeing the same thing in our molecular testing laboratory for tick-borne pathogens. Numbers are going up, cases are coming in for the common things and the atypical or less common things, as you said. And I guess we wouldn't be surprised with this. This is what we're seeing at the national level. Incidence reporting of tick-borne pathogens have more than doubled since 2004, as you know, and as the two of us wrote in our recent manuscript that was published in JCM. So just a few numbers for our audience. Lyme disease, of course, is the #1 vector-borne disease in the United States. It's the if you adjust the numbers, it would have been the third most commonly national notifiable disease in the U.S. in 2019, if you look at the actual projected numbers and not just what was reported. And of course, there are other tick-borne pathogens. And one of the things that you and I have talked about in the past is that the diseases you are at risk for varies based on where you live in the country, what your exposure histories are, and sometimes your immune status as well. So we've created an algorithm to help guide people on which test to order. So do you want to tell us a little bit about that algorithm and how we created it and how we really designed it so that patients get the best tests for them?
Yeah. So this algorithm is available freely online for anyone, which I think is really quite valuable. But it basically starts with looking at the patient's symptoms, but also their geographic location. And then really based on that geographic location, the algorithm asks clinicians to say, okay, if this patient is in the upper Midwest or Northeast, really be thinking about Lyme disease, Anaplasma babesia. If they're more in the Southeast area, consider Ehrlichia and Rocky Mountain spotted fever group pathogens. So it really starts based on geographic location. With that, we then have clinicians consider the symptoms. And based on symptoms, based on the duration of symptoms, we would recommend molecular testing for the majority of the tick-borne pathogens for patients with about 7 days of symptoms or less. Whereas in patients with longer duration of symptoms, 7, 10 days or longer, we would recommend considering serologic testing in those patients. The one exception to that is for Lyme disease, where molecular testing off of the common sources like blood is really insensitive. So for Lyme disease, kind of regardless of stage of or duration of symptoms, we recommend serologic testing, and you might need to do an acute and a convalescent sample in some cases.
Yeah, thanks, Dr.
Um,
Theel. I
yeah.
remember when we created this and we tracked down all the best references, the gold standards from our major professional societies. And then we also had our colleagues from public health look at it to make sure it really was based on science.
Yes, and we review it frequently. And every time that you or I bring in a new vector-borne disease test, we make sure to put it into the algorithm. Or in some cases, we replace tests. So we take out the old ones. We recommend testing using the newer methodologies. So the algorithm, I would say, is kept fairly well up to date.
Yeah, it's a great resource for people. It's available, like you said, freely. You don't have to send testing to our labs in
Mhm,
particular. You can modify it based on your own needs, patient population needs, and the tests that you perform locally.
mhm, exactly.
So, one of the things we've talked about in the past is co-infections because vectors can carry multiple pathogens and they can transmit multiple pathogens in a single bite. So you talked about the importance of geographic location, uh, onset from symptoms, and the time that the patient presents. Uh,
Mhm.
can you please touch on co-infections too and how we've incorporated that into the algorithm?
Yeah, so it's interesting because Ixodes scapularis in particular can transmit up to 5 different things, really, that we know of, at least at this
Mhm.
point.
Right.
And so, for example, Ixodes can transmit Lyme disease, Babesia, Anaplasma. Those are kind of the big three, and up to 40% of patients in the Northeast that are infected with Lyme disease in a few studies have been shown to be co-infected with Babesia. So it's a high rate of co-infection. Similarly, with anaplasma, up to about 15% of patients with Lyme disease will also have an anaplasma infection. And so in our algorithm, we make sure to call out the need for testing for multiple pathogens. From a clinical perspective, why is this important? Well, while doxycycline, which is the most common, treatment method for Lyme disease, while it covers anaplasma and Ehrlichia, for example, it does not treat Babesia, which is a parasite. So for patients that are co-infected with Lyme and Babesia, you'd actually need 2 different types of treatments to cover both agents effectively. So testing for co-infections is really important.
Yeah, it really is an important consideration. And even if you weren't going to treat all patients, there are definitely vulnerable patients where every pathogen might require specific treatment or consideration. And one of the things I hear from my colleagues all the time is that these pathogens, when you have an infection with one of them, the symptoms are very much overlapping. Often it's a
Mhm.
febrile illness, and then there may be additional symptoms like body aches and pains, joint pains, headache, severe headache, nausea, vomiting, maybe a rash, but that could hold true for multiple tick-borne pathogens. So you really need the laboratory test to tell what a patient has, unless, of course, it's that classic erythema migrans rash of Lyme disease.
Yes, the one time we recommend no testing.
Well, we talked
For
about
Lyme.
yeah, right. Um, and we've talked about Lyme and other common diseases, but your lab also tests for some new emerging, somewhat esoteric infections. And I
Mhm.
thought it would be great to highlight some of those because we've definitely been seeing more cases of these in the news. They're still relatively rare, but you've been detecting them in your lab. I've been detecting them in my
Yeah.
lab. Can you highlight a few of those and tell us what laboratorians and our patient care colleagues would need to know about them?
Yeah, so one of the pathogens that we're really excited to offer testing for is Powassan virus. It's a flavivirus transmitted by Ixodes scapularis again. It's found mostly in the upper northwest as well as in northwest, I'm sorry, in the upper Midwest and in the Northeast states. And we are seeing the highest number of positives that we've seen since we went live with the test. And we actually also confirm all of our positive Powassan virus cases. They get confirmed either through your local state health lab or the CDC. And for all of our Minnesota patients that have tested positive for Powassan, they've all confirmed for Powassan virus disease through more specific assays at the CDC. So this is an emerging pathogen. I think the word is getting out in the endemic areas. The problem is that there's not a lot of testing available. So I think it's really going to become more and more important for laboratories that are in these Powassan endemic areas to consider offering testing for Powassan virus. So we offer serologic testing. And Dr. Pritt, I'd be curious to know what you're seeing on your molecular assay for Powassan.
Yeah, we're definitely seeing positives, Dr. Theel. We brought up a molecular assay, as you mentioned, which is really good for that acute stage of the disease, the first week or so. And we just had some recent positives. They're coming in mostly from the areas that you would expect, the upper Midwest and the Northeast, where those Ixodes scapularis transmitted infections are really prevalent. The numbers are relatively low, but still it's a worrisome trend that we're seeing more and more cases. And it could be reporting, it could be that we have better diagnostics. It could also be that, as we know, the tick range is expanding and the number of pathogens that are getting detected, the number of cases getting reported is increasing. So it's something to keep an eye on. And I agree, laboratorians in areas where Powassan virus is endemic may need to consider if they should bring in their own Powassan virus PCR or serology test or both, especially as resources are restricted at our public health labs. They may have a harder time performing testing, and this would be an additional avenue for patients to get tested.
Yeah, that's a good point. Good point.
What about other diseases? What are some of the other things that you've been thinking about?
So,
Some of the less common ones.
well, some of the less common ones are Heartland and Bourbon virus, which unfortunately we don't offer testing for, but I know you do
We do, yeah.
in
We
your
have a
molecular
Heartland
lab.
virus
Mhm.
PCR. We don't offer a specific PCR for Bourbon virus, but we have a new CSF shotgun metagenomics method for cerebral spinal fluid, and that would be able to detect Bourbon virus if it was in the CSF. And then, of course,
Yeah.
there's the new bacterial pathogens that were detected here through teams working with the CDC and public health labs and Mayo Clinic. We have Borrelia mayonii and Ehrlichia muricoclorensis, and we're continuing to see cases of those, and those numbers appear to be rising. And then another thing to mention is we've also detected some novel pathogens that are of uncertain significance. In recent years, we've partnered with the CDC and public health labs. We've detected a Candidatus Borrelia johnsonii. It's called Candidatus because it's still the candidate name. It needs to be described formally. And then we have an Anaplasma bovis-like organism that we've detected in blood. So the clinical significance of these findings are uncertain, but they could also be new tick-borne pathogens. Definitely a lot to think about in our world here.
Yeah, and I think it's really exciting as we get these new diagnostic methods. Metagenomic sequencing, I think, is really going to help identify new pathogens, but also kind of define their role in disease and in patients that probably wouldn't have been diagnosed otherwise. So I think it's a great new tool.
Yeah, I agree, Dr. Theel. And for those that aren't familiar, shotgun metagenomics, essentially, it's a test that has the ability to detect any pathogen in any specimen type, although, of course, it's not that simple, but it could have the ability to detect a virus, a bacterium, a parasite, 3 different pathogens that are capable of causing vector-borne diseases, and they can detect them all at once from a single sample. So it's an emerging field, and I think something we're going to see. It's a very promising testing methodology that we offer, and we're going to see expanded use of that in the coming years. So a lot of
Agreed.
things we've talked about, people may have questions about where they can find out more information. What are some resources we can share with them?
Yeah, so we talked about our algorithm, freely available online. Dr. Pritt, you, myself, and Dr. Kyle Rodino, recently wrote a mini review on tick-borne diseases in North America that was published in JCM. So I think that's another wonderful resource. The CDC, of course, has excellent resources on tick-borne disease, clinical manifestations, and testing as well. Is there another one I'm missing? I feel like I'm
Don't
missing
forget Mayo
something.
Clinic Laboratories. We
And
have
Mayo Clinic
a
Laboratories.
great resource there as well. Lots of updated maps showing the distribution of various vector-borne diseases across the U.S., and then links to our different tests. And again, even if people aren't sending tests to us to be performed, I still think that our lab test catalog is a great resource because every organism and every test has a detailed description of the disease and how it can manifest and the ideal methods for diagnosis.
That's right. I can't believe I forgot it. It's got the best tagline, beat the bite.
Yes, beat the bite campaign. Well, thank you so much, Dr. Theel, for joining us. Is there anything else that you'd like to share with our audience?
I don't think so. I would just say when you're outside in those tick endemic areas, just please remember to use insect repellent. Check your body and your pets for ticks after you come back inside, just to make sure you don't get bit.
Yeah, be careful out there. Avoid those bug bites.
That's
Well, thanks,
right.
Dr. Theel. It's a pleasure having you as always.
Thank you.
Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.